Welcome to lecture 3 of our series of short lectures on joints and kinematics of the vertebral column. Now that we understand the basics of vertebral movement through motion segments, we can begin to look at each individual region, what movements are allowed at that region and why. Starting with extension through cervical vertebra, you can see in this diagram that 80 degrees of total extension is possible. The convex occipital condyles sitting upon the concave superior articulating process of the atlas can roll and slide to about 10 degrees of extension. And at the end of that movement, the anterior atlanto-occipital membrane of those joints and the Z joint capsules at the anterior side of those joints are going to tighten. The inferior articulating processes of the atlas are also slightly concave, and the axial superior articulating process is slightly convex. This also allows them to slightly tilt to about 10 degrees of extension. And at the end range of their movement, the anterior capsules of the Z joints will tighten. Finally, for the Z joints between C2 and C7, you can get some approximation of those joints and also some sliding of those joints down to an inferior and posterior position. This totals for about 55 to 60 degrees of extension. And at the end range of that movement, the anterior longitudinal ligament down the fronts of the vertebral bodies will tighten. The cervical vertebrae are not able to flex as far as they can extend, even though they're using the same mechanisms to move that we've just described. Most people can flex their cervical vertebra between 45 and 50 degrees. And the soft tissues that are actually limiting that flexion are primarily the ligamentum nuchae or nuchal ligament, and to a lesser extent, the supraspinous and interspinous ligaments of the cervical vertebra. The atlanto-occipital Z joints can roll and slide in a similar fashion to they do in extension, but only to about 5 degrees before the posterior occipital membrane and the Z joint capsules that are posterior start to tighten. The atlanto-axial Z joints can tilt anteriorly to about 5 degrees as well, and in this case it's ligamentum flavum that starts to tighten to limit their flexion. And finally, the Z joints of cervical vertebra C2 down to C7 can produce the further 35 to 40 degrees of flexion through the cervical spine by sliding anteriorly and superiorly. Again, it's the Z joint capsules posteriorly that will start to tighten, but primarily throughout this whole cervical spine, it's the ligamentum nuchae and the interspinous ligament that are limiting the flexion of the cervical spine. Here you can see two combination movements: retraction of the cervical spine and protraction of the cervical spine. Quite often they're described as independent movements, but actually they're just combinations of flexion and extension. To protract the head through the cervical spine, you simply need to flex the lower to mid cervical vertebra and then extend the upper cervical vertebra. And to retract the cervical spine and pull the head back in, you simply need to extend and straighten the lower to mid cervical vertebra while you're flexing the upper cervical vertebra. It's using the same mechanisms of movement that we've just described in the past two slides. Rotation of the cervical spine is possible up to 80 degrees on one side or 160 degrees in total. As discussed in a previous lecture, up to 50% of this movement is possible at the atlanto-axial joint, about 35 to 45 degrees of movement to one side. This is achieved by the facets sliding against each other ipsilaterally and contralaterally, and using the dens as the axis point to create a rotational joint between the axis and the atlas. There is no rotational movement allowed between the atlas and the base of the skull. So the remaining 30 to 35 degrees of rotation occurs between the facet joints of C2 down to C7. Again, this is achieved through horizontal sliding of those facet joints across each other, with ipsilateral joints sliding medially and down slightly, and contralateral joints sliding lateral and up slightly. There's been strong evolutionary pressure for us to be able to rotate our cervical spine through such a high range of motion, particularly at the atlas and axis, where we can achieve 50% of that movement. 160 degrees of total rotation, when you add peripheral vision into the mix, gives us almost a full 360 degree field of view, about 330 to 340 degrees in most people. And we can achieve this quickly simply by rotating our cervical spine and not involving our thoraco or lumbar regions, which I'll get to in a sec. This means that we're rapidly able to look behind us and see if there's any approaching danger through vision and hearing. And over the course of your study, when you get to looking at the neural structures and how they interact with cervical spine rotation, you'll come across some audio and visual reflexes that enable you to produce that movement without even thinking about it. The trade-off with that is that the only thing holding the dens to the atlas and stopping it from translocating and damaging your spinal cord is those cruciate ligaments and apical ligaments anchoring it to the base of the skull. Fine in the course of normal activities, but if you start to think about high velocity activities like being in an automobile, being on a bike, being in an aeroplane, it starts to put those structures at risk if you have an impact. If we now look at lateral flexion of the cervical spine, there's a total of 35 to 40 degrees movement possible to one side. Similar to flexion and extension, the occipital condyles are able to roll and slide on the superior articulating facets of the atlas, in this case to about 5 degrees. The pivot joint setup of the atlantoaxial joint means that there's no real lateral flexion allowed at this joint. And the remainder of the 30 to 35 degrees of lateral flexion is achieved through the Z joints of C2 down to C7 by allowing the ipsilateral side to slide inferiorly and posteriorly and the contralateral side to be able to slide superiorly and anteriorly. Before beginning to look at movements through the thoracic region and the lumbar region, it's important to point out again that the thoracic region has rib joints attaching to those thoracic vertebrae. The ribs and their joints impose movement limitations on the thoracic vertebra and vice versa. The thoracic vertebra impose movement limitations on the ribs themselves. But in this case, we're just looking at what movements are possible at the vertebra. Firstly, looking at the orientation of the thoracic Z joints, you can see that if you're looking at them from a lateral view, they're almost vertical, about 15 degrees offset to vertical on average. As seen in a previous lecture, if you look at the thoracic vertebra from above, a superior view, those facets are orientated to a frontal or almost tangential plane. This means that when thoracic vertebra move into flexion, they simply slide those facet joints superiorly and separate that joint space slightly. What you can see in the top right diagram is that if we don't move the pelvis during this movement of thoracolumbar flexion, then that becomes the limiting factor for both thoracic and lumbar flexion. And by extension, you can see the tightness in the hamstrings running from the pelvis down the back of the legs. Thoracic vertebrae in total are able to achieve about 30 to 40 degrees of flexion. If we now look to the lumbar facet joints and look down at that bottom left diagram, viewed from above, the facet joints are radial in nature and sometimes almost mid-sagittal. Viewed from behind, as in a previous lecture, those facet joints of the lumbar vertebra are almost vertical, with the one exception being the L5 to S1 facets that are frontally arranged to increase that anterior-posterior stability. This facet joint orientation allows the lumbar vertebra to flex through about 45 to 50 degrees of movement. As you can see in that bottom right diagram, the facets simply slide superiorly and anteriorly against each other to produce that. In the masterclass this week, we're going to explore the concept of lumbopelvic rhythm. As I said, when flexing through the thoracic and lumbar spine, if we don't move the pelvis, then the pelvis itself in its position and the hamstrings down the back of the leg become the limiting factor for that movement. By tilting the pelvis anteriorly, we're able to increase the range of movement for lumbar flexion and then thoracolumbar flexion as a whole. We'll explore that in detail in the masterclass. The thoracic vertebra are able to produce about 20 to 25 degrees of extension. Simply through the opposite mechanism to flexion, their facets slide inferiorly and slightly posteriorly to bring those Z joints back to a closed packed position. At the end range of this movement, it's mostly the anterior longitudinal ligament that limits the extension. The lumbar vertebra are able to add about 15 to 20 degrees of extension. simply by the facet sliding inferiorly and slightly posteriorly back to a close packed position. As discussed during flexion, the mechanism of lumbo-pelvic rhythm is going to have to come into play to achieve full range of motion through extension of the thoracic and lumbar spine. Even ignoring this for a moment, you can see on the top diagram that as you move into the last end ranges of lumbar and thoracic extension, the structures at the front of the hip flexors and the ligaments running from the pelvis out to the femur are going to tighten and limit that movement. When considering thoracolumbar rotation, the orientation of the facets in the thoracic and lumbar regions strongly dictate what sort of movements are allowed. You can see in the top right picture that the facets for the thoracic vertebra are orientated frontally or tangentially. This means these facets can simply slide against each other horizontally to produce the rotational movement. When viewing the lumbar vertebra from above, you can see the radial orientation of the facets. And you can imagine that as you try and rotate lumbar vertebra against each other, the only movement allowed is by the approximation or closing of that joint space between the facets before they impact each other. This means the lumbar vertebra are only capable of 1 to 2 degrees of rotation against each other, and in total about 5 to 7 degrees across the whole lumbar region. And finally, we'll discuss lateral flexion at both the thoracic and lumbar vertebra. Thoracic vertebrae are capable of about 25 to 30 degrees of total lateral flexion. Due to the frontal orientation of their facets, they're simply able to slide against each other so that the ipsilateral side slides inferiorly and the contralateral side slides superiorly. When looking at this mechanism, you could imagine that thoracic vertebrae would have a higher range of motion through lateral flexion than they actually do. The reason they don't was discussed previously. That is that thoracic vertebrae have ribs attaching to them through the costotransverse and costovertebral joints. These joints limit the amount of lateral flexion that is allowed at thoracic vertebra. Viewing the lumbar vertebra from behind illustrates the vertical orientation of their facets quite well. And what this shows is that lumbar vertebra can laterally flex to about 20 degrees of range of motion through almost the same mechanism that the thoracic vertebrae do. That is, the ipsilateral side slides inferiorly and the contralateral side slides superiorly.